I'm Neely, and it's time for the shortcut. Coming up on tonight's show, studies have shown that the U.S. healthcare system continues to rank last amongst high-income countries. Our next guests say fixing a broken system starts with the doctor you may not be seeing. Joining me are two of the founding partners of Primary Care for America, Sean Martin and Dr. Ruchika Fernandopoulos. Hi, you two.
Hey, thank you.
Thank you for joining us. So, doctor, what is the main role of a primary care team and why should we all have one?
So Barbara Starfield, who is a health policy professor at Johns Hopkins, talked about the 4 C's that make up primary care. It's comprehensive. It takes care of the whole person, not just a part of you. It's continuous, so it's based on a long-term relationship, not seeing a different person every time. It's first contact. It's a place you can go for anything. And then coordination helps you coordinate the whole rest of the healthcare system. You know, health is very complicated, and our healthcare system is maybe even more so. And so we really all need this in order to optimize our health.
Studies show that the U.S. spends twice as much per person on healthcare than any other developed country, yet we're less healthy. What needs to occur to improve our healthcare system?
Well, sure. We do know that individuals that have an ongoing relationship with a primary care physician or a primary care team tend to experience better health outcomes and be healthier over the course of their lifetime. So understanding this, we need to prioritize access to affordable primary care for more individuals. And we need to prioritize better health care over the course of a lifetime versus just focusing on patients when they are sick.
And doctor, why should patients get involved to influence change when it comes to funding for primary care?
This is really about our own health and the health of our families. And when we're relying on trying to navigate this broken healthcare system by ourselves, we're vulnerable to preventable diseases, to chronic diseases that aren't well controlled, and we're not making the right decisions. And a healthcare system that prioritizes primary care will really help us deal with whatever nature happens to throw at us. I think as all of us get older, we're more and more subject to getting diseases. I've had the privilege to start and run what's called an advanced primary care practice. We were able to convince a number of payers to pay us double typical primary care, to have more time with patients, to be able to invest in teams and technology to help them actually optimize their health. And what we've shown over more than a decade is significantly better patient experience.
Thank you too for joining us on the shortcut. For more information, you can visit primarycareforamerica.org. That's all the time that we have for tonight's show. I'm Neely, and I'll catch you next time on the shortcut.